Yes.
Did I say that right?
Yes.
Welcome. I see you're here for your first prenatal visit. Congratulations.
Thank you.
You're welcome. All right, just check your info here for me. Has anything changed?
No. Everything's accurate.
All right, I'm gonna go ahead and get your height and weight, and then I'm gonna need you to give us a urine sample.
Okay.
And I'll bring you back into the room, do vitals, and the doctor will come in and assess you.
Sounds good.
Okay.
Hello.
Hi, how are you today?
Good.
I'm Dr. B. I see that you are here for your first prenatal visit.
Yes.
Okay, congratulations. Your name and date of birth for me?
It's Carol, and it's August 12th, 1990.
Okay, perfect. All right, so just a couple things that I want to go over with you. So prenatal care is basically just, it's going to be throughout your whole pregnancy. It's just to have a better outcome for you and your baby. So you're going to have a bunch of visits with us, okay? So from 4 weeks until 28 weeks, you're going to be here about once a month. I know we already did your urine sample, your vital signs looked good. I actually have a prescription here. We're going to send for blood work and an ultrasound to confirm and date
Okay.
the pregnancy. Do you know when your last menstrual period was?
It was 8 weeks ago.
Okay. Okay, so up until 36 weeks, you're going to have one prenatal visit every 2 weeks. And then throughout that time, we'll do glucose screening for gestational diabetes. We'll also do a group B strep. That's usually done like 35 to 37 weeks. And then we'll also do a non-stress test too, which is usually done at 28 weeks. And that's just to confirm the fetus's health, okay? And then once you hit 36 weeks, you'll come once a week because you're kind of getting towards the end. So we'll check your weight gain, you know, how the baby's growing, fetal heart rate, and then we'll start checking the positioning too.
Okay.
Okay. Now, as far as your past medical history, do you have high blood pressure?
No,
No.
and it doesn't run in my family or my husband's.
No. Okay, perfect. How about heart disease? Anything like that, or
No.
no? Okay. Any other family history that you can think of that we should be aware of?
No, I don't
No,
think
any-
so.
Okay, all right. And then I know I mentioned weight gain, so we'll just track that every visit that you come, because that is just an appropriate way to see how the baby's growing, because you should be gaining a certain amount of weight through each trimester. Okay. And then I'm gonna send the nutritionist in after we finish up, just so she can go over any like vitamins or anything if you have any questions for her. Okay. So here is your prescription
Thank
for
you.
the ultrasound and the blood work. And then just on your way out, don't forget to make an appointment at the front desk, because you'll have to come back next week, or I'm sorry, next month. So you'll just have to come back next month so we can just, you know, keep on top of things. And,
Okay.
all right. You have any questions for me?
I don't think
No?
so. I think you
Okay.
covered everything.
All right. Well, it was so nice to meet you.
I'm sure I'll see you soon.
Okay. Take care.
Hello.
Hi, how are you?
Good.
I'm Danielle, nice to meet you, I'm your dietitian. So I hear you're here for your 8th week visit.
Yes.
So I just wanted to go over some basic stuff with relation to nutrition.
Okay.
And then at the end, if you have any questions, we'll go over.
Okay.
So are you currently taking your prenatal vitamin?
I just started, yes.
Okay, good. So that's usually the first thing that is recommended when you find out you're pregnant, or even if you're thinking about getting pregnant. One of the other things that I did look up, I did check your BMI, it was 20. So your pre-pregnancy BMI is normal. Do you know what BMI is?
No.
Okay, that's your body mass index, so that is your weight compared to your height, and you're within normal range starting off.
Oh, good.
So based on that, you would be looking at gaining about 25 to 35 pounds for your whole pregnancy. So when you come in and you get weighed each time, they're going to take a look at that weight and see if it's going along in those parameters.
Okay.
Okay. The other thing that's really important in terms of vitamins during pregnancy is folic acid. So you'll notice that on your prenatal vitamins, it should be 400 micrograms per day. And the reason why folic acid is very important is it helps prevent any spinal issues with the fetus, prevents against spinal cord deficiencies with the fetus, like spina bifida and things like that.
Okay.
So they call it neural tube defects, but you may not understand that term, so.
So if I
it's-
weren't taking these vitamins, then I would have a
Yeah,
higher risk?
Risk, right, so this is why that's really important. The other important vitamin that they make sure is calcium intake. That's about 1,000 milligrams per day. And then one of the other things too, do you eat fish?
No, not
Okay.
really.
Okay, so one of the things to really watch out for is mercury intake. So some fishes are high in mercury, and they've been linked to birth defects. So one of the ones that is very popular that people do eat is tuna. So you want to limit that to about 6 ounces a week. And then, do you eat sushi or any kind of
No.
unprepared? Okay, so that's another thing to kind of stay away from. You want to make sure everything is cooked, washing foods very well. We want to prevent any kind of food poisoning to occur during the pregnancy. Keeping your kitchen clean, and like I said, avoiding any raw or undercooked seafood, eggs, and meat. Okay. Your milk, do you drink milk? And it's pasteurized and all that, or
Yes.
you don't get it from a local farm? Okay.
No.
That's important too, because you definitely want to have pasteurized milk. I know we have a lot of farms in the area, so you want to make sure you're drinking, pasteurized milk. Be careful of now it's getting to summertime, so we're going to a lot of barbecues. So make sure when you go to barbecues, all the meat is cooked through, like the chicken and the beef, and any other processed meats you might want to stay away from, like luncheon meats and hot dogs, cold cuts. You want to prevent other types of infections, bacterial infections that can occur without really consuming things that are not cooked all the way through. So that's pretty much what I have for basics. I don't want to overwhelm you as we go through each session. I'm here a few times a week, so a lot of times I'm available to come in and speak to you. Do you have any questions at this point?
I guess I'm just trying to understand. So if I follow all these like general food guidelines and take my prenatal vitamins and come to my appointments, I should have like better outcome and a healthier like pregnancy, and my baby will be healthier. And is that what?
Well, basically for the nutrition pieces, we want to make sure that you're gaining weight appropriately, you don't go over and you're not under, so that helps ensure that baby is also an appropriate size and weight gain during the pregnancy. Nothing is 100% sure, but of course we want to reduce risks as much as we can.
Okay.
So based on the current guidelines, in terms of eating, you want to make sure you get a variety of foods in your diet from all the food groups, your grains, your vegetables, your fruit, and definitely some protein from your, chicken, lean, low-fat proteins, or turkey in your diet. Again, you can eat fish. I know you don't, but you can, just watching the mercury levels. And, and the old myth of eating for two, all you have to do is basically eat an extra couple of 100 calories per day to, supply the baby with extra nutrition. And you'll be able to see when you come in for your appointments if you're meeting your weight gain per week, per month that you're supposed to. If not, then at that point we can encourage you to eat more. Or if you've exceeded, then we may want to say, okay, just level off at this point and stay where you're at.
And this will reduce my risk of complications throughout pregnancy?
It will help reduce risk for complications or any birth defects, but again, as you go on, we're going to be doing more tests, and the doctor will be talking to you about that at your next visit.
Okay.
So we're just early on right now, but right now continue a regular diet, a balanced diet, and take your prenatals, and you should be good to go.
Okay, thank you for your time.
You're welcome. All right, it was nice meeting you again. Take care.
Okay. She's recording. Okay.
Hi. How are you today?
Good, how are you?
Good. So I see you're here for your first prenatal visit. Can you just confirm your
I looked up premature.
I can't do it. Make it up.
They're never.
And date of birth for me.
It's Carol. It's just like doing it on my date of birth.
Do you have any questions at this point?
Okay, let's pretend that's a pause there.
Hi, can I have your name?
Alright, go.